So we started at 6 and we worked our way around, surfaces away, surfaces away, surfaces away, away, away. Now I want to come and finish the tooth off. So what I'm going to do is I'm going to start with number 11, and then now I'm going to go surfaces towards. So because these were the headlights and I was going away, this is the direction that my point was going. Now that I'm doing number 11, I'm going to just turn the instrument around, and now my headlights are going this way because now I'm going this way, okay? Again, same sequence. We're going to start at the midline. I'm fulcrum now right here on about, 9 or 10. Handles parallel, lower 1/3 of the tip, okay? And I'm going, and I'm going, and I want you to see what my fourth finger's doing because I've got to get that tip. So now my fourth finger is going this direction, okay? When I was going this direction, I was pivoting away, no, pivoting towards me. Now when I'm here, I'm going to be pivoting away, okay? And all this is so that we can keep this lower 1/3 tip adapted correctly on the tooth surface and not cause any trauma, okay? So I want you to practice on that. Some of the struggle that I see with students in the beginning when we start learning how to use and put all this together is that fingers tend to fall apart, or they'll go over like this, or you'll have it down, you'll have your index holding it like this, and there's lots of little things that can go wrong because there's a lot to put together. So I want you to take it slow, and I want you to practice with it, and I want you to try to get good at it. So now I'm going to go over here to my typodont, and I'm going to just give you a little bit of a demo on what we're going to be doing on these maxillary surfaces, okay? Now, again, when we're on the maxillary linguals, it's a totally different game changer because we can't see and we can't put our head up there to look like this. So we have to rely on our mirror for indirect vision. When we were doing the anteriors, you simply cup your mirror, and then you just use your fingers to retract the lips when you're doing, the surfaces away and towards on the facial. But when we're doing the linguals, it's very important that you learn to rely on this mirror, because your mirror is a tremendous asset to you when you're working, because if you cannot see where you're going, you can't see what you're doing. I mean, that makes common sense, and you're going to miss places, and just a trickle-down effect. Okay, so according to your book, when you're working on the linguals of number 6 to 11, surfaces away, there's different places where you can sit. And again, we don't have our units with us. We're not chair side, so we're just going to have to kind of wing it. But I typically would be at like 11 o'clock. I would have my mirror like this, and I would be holding my instrument like this, fulcrum on the lingual of number 4 and 5, and I would be on the midline of number 6, and I'm going surfaces. Can you get that? Number 6, and I'm going surfaces away. Okay? And then you just adjust your mirror. Now, your fingers can split if you're using the mirror. Sometimes it's almost impossible to keep your fingers and together with the mirror. I mean, we like to have pretty hygiene hands, but sometimes we're just not always able to do that. Again, you have your patient here like this, and then you're going to have your dental light coming up, like this a little bit. I'm trying to get my desk lamp over here so you can see it a little bit. All right, and there I am on the lingual of number 8 at the midline. Okay. And I'm rolling it, and I'm rolling it, and I'm keeping all my fingers together the whole time. Okay, when I'm doing surfaces towards, then and so some of you may find it easier to do that at 12 o'clock too. So again, this is just kind of a demo to give you a little bit of an idea of how we're doing it. Some of you may find it easier to be at 12 o'clock when you do this, and that may work a little bit better. You do have to have even if some kind of a fulcrum for your mirror. So whether it's anterior, extraoral fulcrum, like on your patient's cheek, that's also acceptable. But the thing that's important is that you are able to see what you're doing and that you're able to keep the blade adapted. You don't want your blade to go out this way. You don't want you always want to try to keep the handle parallel with the surface that you're working on.